Are you over 60? Then you need to hear this, because these 7 warning signs could be the only clues your body gives you before something serious, even fatal, happens. Most people ignore them, but today you won't. And that could save your life or someone you love. Welcome to Better Life After Golden, Jubilee, where we share life-saving health tips, inspiring stories, and powerful habits to help you thrive in your golden years. In today's video, we're diving into 7 medical warning signs that often show up subtly, but signal real danger, including stroke, heart failure, and more. These aren't just random symptoms. They're your body's red flags, and they deserve attention. So if you're ready to protect your health, stay independent, and live fully after 60, hit that like button, subscribe, and share this with someone who needs to see it. Because the truth is, many seniors brush off these signs until it's too late. But not you. You're here because you care. And that's exactly why this channel exists, to give you the tools, insight, and support you deserve. Let's get into it. And don't miss the final warning sign. It's the one even doctors often overlook. 1. Sudden chest discomfort. Let's start with one of the most misunderstood warning signs. Sudden chest discomfort. Now, when most people hear chest pain, they picture that dramatic movie scene, someone clutching their chest and collapsing. But in real life, especially for those over 60, it often doesn't look that way. The discomfort might feel like pressure, tightness, heaviness, or even a strange sense of fullness. And here's the real danger. Many seniors confuse it with something as harmless as indigestion or gas. You might feel a squeezing sensation, like someone is sitting on your chest. It might last a few minutes, go away, and then come back. It could show up after light activity, or even while resting. You may also notice pain in the neck, jaw, back, shoulders, or arms. These are all classic symptoms of a heart attack, yet they're often ignored or brushed off. And here's something that could save your life. If you feel any chest discomfort that's unfamiliar, persistent, or just doesn't feel right, don't wait. Don't Google it. Don't take a nap. Call emergency services. Time is critical. The sooner you get help, the more heart muscle you can save, and the better your chances of full recovery. Let me share something personal. A viewer once messaged me about their father, who complained of a weird chest pressure after dinner. He said it felt like gas. They waited it out. The next morning, he had a massive heart attack in his sleep. That family never saw it coming, and they now live with the weight of what if. If you take only one thing from this video, let it be this. Don't ignore chest discomfort just because it doesn't hurt. It could be your heart's final warning. And trust me, your life and the lives of those who love you are worth making that call. 2. Unexplained shortness of breath. Have you noticed yourself getting winded while doing things that never used to bother you, like walking to the mailbox, climbing a few stairs, or even just getting dressed? If so, don't chalk it up to just getting older. That kind of unexplained shortness of breath could be a serious red flag, one your body is waving loud and clear. When you're over 60, sudden or increasing breathlessness, especially during routine activities, may point to heart failure, lung disease, or even blood clots in the lungs. These aren't minor issues. They can develop quietly over time, then strike hard and fast if ignored. Here's why it happens. When your heart isn't pumping efficiently, fluid can build up in the lungs, making it harder to breathe. You may not feel chest pain, but you might start needing more rest between tasks or feel like you just ran a marathon after a short walk. That's your heart or lungs telling you something isn't right. The tricky part? Many seniors think it's normal to slow down, to feel a little out of shape. But if you're suddenly short of breath doing things that were once easy for you, it's not normal. It's a signal, one that deserves your full attention. A woman from Houston once shared her story. She thought her breathlessness was just due to being out of practice after winter. It wasn't. It was early-stage congestive heart failure. Thankfully, she saw her doctor in time, got treatment, and completely turned things around. If you feel breathless without a clear reason, especially if it comes on suddenly, or gets worse over days or weeks, don't ignore it. Don't wait until you can't breathe at all. See a healthcare professional. Get it checked. Because every breath you take is precious, and your golden years are meant to be lived fully, not gasping for air. 3. Irregular heartbeat or palpitations. Have you ever felt your heart suddenly flutter, skip a beat, or race out of nowhere, like it's doing a little dance in your chest? It might last a few seconds or minutes. You might think it's just stress or maybe too much coffee. But if you're over 60, you can't afford to ignore it. These sensations, known as palpitations or an irregular heartbeat, could be signs of a deeper issue, such as atrial fibrillation, AFib, one of the most common heart rhythm disorders in older adults. And here's the serious part. AFib increases your risk of stroke by up to 5 times. Now, not all irregular heartbeats are dangerous, but the ones that can sneak up on you. They may feel like a flutter, thud, racing pulse, or strange rhythm. Sometimes they're accompanied by dizziness, weakness, or shortness of breath. Other times, they come and go quietly. That's what makes them so easy to brush off and so dangerous. Here's the thing, it's not always anxiety. That's a common myth. Many seniors assume those sudden flutters are just nerves or caffeine. But if these episodes are happening more than once, or are accompanied by other symptoms like fatigue or lightheadedness, you need to get your heart checked. I heard from a man in his late 60s who felt what he described as butterflies in his chest during the night. He chalked it up to nerves about an upcoming trip. A week later, he had a minor stroke, triggered by an undiagnosed arrhythmia. Thankfully, he recovered. But that experience taught him, and now hopefully, that your heart's rhythm matters. So if your heartbeat feels off, irregular, or unsettling, don't assume it's nothing. Talk to your doctor. They can run a simple EKG or Holter monitor test to catch hidden issues. Catching an irregular heartbeat early could mean the difference between managing a condition and facing a medical emergency. Your heart has carried you this far. Make sure it keeps beating strong. 4. Sudden dizziness or loss of balance. Have you ever stood up and suddenly felt lightheaded or found yourself losing balance for no clear reason? Maybe the room spun for a moment, or you had to grab onto something just to stay upright. It might seem like just one of those things. But here's the truth. A fall isn't just a fall. It could be your brain warning you. For those over 60, sudden dizziness or balance issues aren't always harmless. They can be symptoms of something far more serious, like a stroke, inner ear disorder, low blood pressure, or even heart rhythm abnormalities. These conditions don't always come with dramatic symptoms. Sometimes, a simple stumble or brief moment of disorientation is your body sounding the alarm. Many seniors dismiss these episodes, blaming dehydration, fatigue, or simply getting older. But let's be clear, if you're feeling dizzy often, or out of balance without a clear cause, that's not normal aging. That's a signal. Here's a sobering fact. Falls are one of the leading causes of injury and death in older adults, and they're often triggered by underlying medical issues that go undetected. What seems like a small moment of unsteadiness could actually be the beginning of a stroke, or a sign that your blood pressure is dangerously low. A woman once shared how her father, an active, 72-year-old, started feeling a little off balance now and then. He brushed it off. One day, while stepping off a curb, he fell and hit his head. The ER revealed he'd had a minor stroke days earlier, and those dizzy spells were the warning signs. Here's what to do. If you experience sudden, unexplained dizziness, a spinning sensation, or a loss of balance, especially if it happens more than once or is accompanied by blurred vision, weakness, or slurred speech, don't ignore it. Get evaluated right away. Your brain, heart, and nervous system work together to keep you upright and aware. When one of them sends a signal, even a small one, it's your job to listen. You've come too far to take chances with your balance. Protect your steps, protect your life. 5. Persistent fatigue without reason. We all have tired days. But what if that tired feeling never goes away? If you find yourself constantly drained, no matter how much sleep you get, no matter how little you do, then it's time to stop brushing it off. Because persistent fatigue, especially when there's no clear reason, is your body's way of waving a red flag. Many seniors assume low energy is just part of getting older, but that's not always true. In fact, if you've lost your usual spark, if getting out of bed feels like a chore, if you're falling asleep mid-afternoon, or if normal tasks suddenly feel exhausting, something deeper could be going on. This kind of ongoing fatigue can be a sign of several underlying issues, including anemia, when your body doesn't have enough healthy red blood cells to carry oxygen, thyroid problems, especially hypothyroidism, which slows your metabolism and drains your energy, chronic infections, or autoimmune conditions, silently sapping your strength. And in some cases, certain cancers start with nothing more than a slow, creeping fatigue that builds over time. The key difference here is fatigue without reason. You haven't changed your routine. You're not recovering from illness. But suddenly, your get up and go is gone, and it's not coming back. Peter, 68 years old, shared how he went from walking 2 miles every morning to barely making it around the block. He thought it was just aging, until his doctor found his iron levels were dangerously low. After treatment, his energy returned, and so did his quality of life. So here's your signal. Don't ignore tiredness that lingers. If rest doesn't fix it, if your body feels like it's slowing down for no reason, get checked out. Blood work, a physical exam. Even a simple conversation with your doctor can uncover the root. You deserve to wake up feeling alive, alert, and ready to live. Don't settle for just tired. Your body may be telling you it needs help. Listen before it's forced to shout. 6. Swelling in legs or ankles. Have you noticed your shoes feeling tighter than usual? Or your socks leaving deep marks around your ankles? Maybe your legs look puffier by the evening. Or you feel heavier on your feet for no clear reason. It's easy to shrug this off as just getting older, or maybe a salty meal, but here's the truth. Swelling in your legs or ankles can be a red flag in disguise. This condition, known as edema, often starts subtly. A little puffiness here, a bit of tightness there. But behind it could be a serious issue: heart failure, kidney problems, or even liver disease. When your heart isn't pumping blood effectively, fluid can begin to collect in the lower parts of your body, especially the legs, ankles, and feet. Similarly, when your kidneys or liver aren't functioning properly, they can't remove excess fluids as they should. The result? Swelling that seems harmless, but could be the first warning of a much deeper health problem. Here's what's tricky. This kind of swelling usually doesn't hurt. It's quiet. It builds slowly. And because it's not dramatic, many people ignore it until it starts affecting their mobility, breathing, or energy levels. Angela, in her 70s, told us she thought her swollen ankles were just from sitting too much. But when her doctor ran tests, they found signs of early-stage heart failure. Because she caught it early, she was able to start treatment and avoid a serious crisis. Here's what to watch for. Swelling that gets worse as the day goes on. Skin that looks stretched or shiny. Shoes or socks that no longer fit right. Weight gain without changes in diet. If you're seeing these signs, especially if they come with fatigue or shortness of breath, don't ignore them. It's your body's way of saying something's not right. Swelling may seem like a small issue, but it could be the first step in a much bigger health story. You've worked too hard to ignore the signals now. Listen to your body. Take action. Stay ahead of the danger. 7. Sudden confusion or memory changes. Have you ever noticed yourself or a loved one acting off all of a sudden? Maybe they're forgetting simple things, getting lost in familiar places, or struggling to find the right words. These aren't just senior moments. Sudden confusion or memory changes could be signs of something far more serious. In older adults, cognitive changes like confusion, memory loss, or trouble concentrating may indicate a stroke, an infection, or even the early onset of dementia. The thing is, these changes can come on quickly. 1 minute, you're talking to someone, and the next, they seem lost or distant. It can be alarming, especially when the person affected has no history of memory problems. A stroke, for example, may cause confusion, difficulty speaking, or trouble understanding speech. These symptoms can happen suddenly, often without any physical signs like weakness or numbness. Every second matters when it comes to strokes. So recognizing these cognitive shifts right away can literally save a life. On the other hand, infections, especially urinary tract infections, UTIs, are often overlooked in older adults but can cause severe confusion and behavioral changes. Infections that affect the brain or nervous system can make a person seem disoriented, irritable, or confused, symptoms that can easily be mistaken for dementia when, in fact, they're treatable. And then, of course, there's dementia, something we all fear as we age. Early signs of dementia can be subtle, but if someone is suddenly forgetting everyday details, or if their personality changes quickly, it's time to see a doctor. The earlier you catch cognitive decline, the more manageable it can be, and there are treatments and strategies that can slow its progression. If you notice sudden confusion, forgetfulness, or disorientation, whether in yourself or a loved one, don't wait. It's easy to brush off these changes as aging or stress, but it's crucial to act quickly. Whether it's an infection, a stroke, or something more long-term like dementia, early intervention is key. You deserve clarity, connection, and peace of mind as you age. If something feels wrong, trust your instincts and seek help. Taking action now could prevent something worse tomorrow. Have you experienced any of these warning signs or noticed them in a loved one? Share your story in the comments below. Your experience might just be the one that helps someone else recognize the signs and take action before it's too late. If this video helped you recognize those important warning signs, don't forget to hit that like button and make sure to subscribe for more essential tips that can help you live your healthiest, happiest life after 60. Let's make these golden years truly shine together. Thanks for watching today, and see you in the next video.